The intro is going to be something like, I'm Dr. John Dolatorre, this is the Texas Psychologist, and here's what you're going to hear in today's session.
And it is McKenna hitting her mic 5,000 times.
Welcome, everybody. I'm Dr. John Dolatorre. This is the Texas Psychologist podcast. I am here with Dr. McKenna Herford, better known as Dr. Mac on the social. Today is the first day of the TPA convention 2025 here in San Antonio. We had just had our first keynote address, which discussed CPT codes and private payer and making sure that we're being reimbursed, and all of that's kind of for a later episode. What I want us to talk about, though, is it's now breakout session time, right? For the next 2 days, it's going to be all of the things that you're most interested in seeing and doing and hearing from those professionals. What are your plans for what you want to attend?
So I'm interested in anything ethics related, and not just how it's coded, I guess, in terms of a continuing education piece. But I think in my mind, I'm thinking macro level for the things that are impacting our clients currently. So when we think about the current political climate and how that's impacting folks, I'm excited to do some couples stuff, which I haven't seen couples in a while, but I feel like a conference is a good time to branch out. I think a lot of times we're so probably desperate to make sure we get our CEs in time to renew our license. But I think the cool part of a conference is you can branch out. So I was looking at a lot of different options, even for later today. I was even thinking about doing some forensic stuff, although I am I'm not a forensic psychologist. Also, too, I'm interested in hearing more about the advocacy piece. Honestly, to me, that one is standing out more than the breakout rooms, just considering everything going on. Like, what is APA doing on our behalf? We heard that a little bit this morning, but I think hearing on a macro level what we're going to be doing, and then also for Bexar County Psychological Association, and hearing these different strategies that TPA is using in order for us to connect better, reach more people. I think we all feel really isolated, and so yeah, I'm excited. It's always tough when you're debating between two breakout rooms too, and so some of them, I'll be honest, I haven't officially decided on. I'm gonna wait to see how I feel in the moment.
So, but you're kind of known for having a spiciness to the content that you post on social media. What do you think is the role of advocacy when it comes to the individual practitioner as opposed to the field as a whole?
That's a good question, and I think it depends on the person and their unique strengths. I think that is more important now than ever. Instead of trying to do all of the things, I think there is pressure we have to advocate in every single way that we possibly can, which just frankly leaves a lot of us understandably frozen, paralyzed in some way. I think then leading into whatever your strengths are. If you're a person that is very social, I don't know how much of our field is, but that's a unique strength to have. If you're that person that loves networking, we need you. We need you to go out and create relationships, and whether it's with other people in our profession, whether it's with legislators, that kind of weaving person. If you're a person that is really good at looking things up and resource gathering, we need that. We need people that are willing to kind of zoom out and look at the big picture and are willing to make really difficult decisions where maybe there is no easy solution, or the solution is one that probably not a lot of people are gonna like. But I also think there is space for a certain level of spice. I think, me personally, I'm more mindful of that this year in terms of, everyone's feeling spicy. So now I'm in this weird spot where, can I help you channel that?
Dr. Mac is the handle. Thank you very much, Dr. Herford, and good luck
Awesome.
on
Well,
your
thank
sessions.
You.